Hi, Olga.
Hi.
This is your last day at our Rescue Foundation today, unfortunately. You have been working here with us for 6 weeks, and I'm very sorry that you have to leave, but of course it's for a good cause, for your further career. But maybe you can tell our followers a little bit more about your history, where do you come from, what brought you here to the Netherlands, yeah, things like that. What's your former working experience as a vet, and yeah, things like that.
Okay, so my name is Olga. I am young equine veterinarian. I'm coming from Poland, and I came here to the Netherlands seeking for a job. But at the end, I'm going to start my first job, my internship in Denmark, in an equine clinic. And in my gap, in between finishing the university and starting the new job, I decided to help a little bit to get engaged in the work of the Dutch Rescue, which was basically a little bit of life coincidence, but I'm really happy that I get this opportunity, and it was really a wonderful 6 weeks here. So yeah, my plan for the future is to become a very good vet. Good is enough, but I would like to be specialized in orthopedics, and I would like to and my interest is also welfare of horses, especially in the areas of sport. So yeah, that's.
So you said welfare of horses?
Yes, welfare of horses.
Yeah. Mm-hmm. Okay, we will come to that later, right? Okay, yeah, you got here, and I was wondering, what was your first impression when you got here at our foundation? I don't know if you had any if you had imagined something, how it would look like, how it would be, how we would work. So what was your first impression when you came here?
First of all, I didn't have any specific expectations. I only knew how the cooperation with rescues look like in Poland, like cooperation between a vet and rescues or foundation. So I knew that it's not always easy to communicate together, because sometimes I felt like we have different perspectives on problems. So I really wanted to see how it really works and what the problems horses and people who manage the rescues are facing every day. So I could speak easier with those people who I meet, because I believe we want the same. We want the good for horses, but we sometimes understand it a bit better, a bit different. So I didn't have much of expectations, but my first impression of working here was that I saw the horses who are really in good conditions, and of course they have their own issues and they have their history. But generally speaking, I see the horses who are really happy, who are healthy, and I didn't see negligence of the horses, that some people are blaming rescues for that. I was really impressed that all the horses are really in good conditions. As I said, they have their own issues, but which horse doesn't, basically? And I think that they have happy life here because they are 24 hours outside, they have unlimited movement, they have friends, they are socialized, and they are also friendly to people. So that was my first impression, that it's a really nice place. And the second thing that made me sleepless was that Petra is doing a really hard job here. Like, it's a one person who is feeding horses, cleaning horses. She's doing everything, like everything is on her back. She of course has volunteers, but the foundation is something really fluent. Like you are never sure of tomorrow, if you will still have volunteers or you will still have donations, and at the same time she's managing it, she's managing visits for people, giving lessons, doing a Facebook, So I was like, it's too much for one person. So I felt like really happy to also help her, so she could feel a bit more like supported, and
yes. Yes. Yes, thank you. That's it's nice that you noticed that, and it's indeed a lot of work for a one-man show, of course, with volunteers. But the end responsibility indeed is in my hands, and yeah, it's sometimes a lot indeed. And so you can imagine, I was indeed very happy that I had somebody to level with, especially on the medical issues, and also about the hooves, of course, since I do all the trimmings of the hooves myself, apart from 2 horses that have now 2 hoof trimmers that have adopted their horses, but all the 16 other horses I have to do the hooves myself. But thank God you are able to do it as well, and you help me with that. So that brought me on the next question. Would you tell our followers, what did you do here when you were here? What was your day looking like as a vet and as a volunteer?
So I was helping in the morning routine, like feeding, bringing nets through the mud every day.
What mud?
What mud?
We don't have mud.
There is no rain in Denmark. What are
years.
you talking about? No. So yeah, feeding horses. My favorite was training of a sheep nest, which is really fun. Anyway, I was trimming hooves. I was walking horses. What else? Of course, I was cuddling, and we did a lot of medical checkups for like every day, like checking teeth, auscultating horses, of course, like all the medical checkups that I could do, I think I did.
Yeah, the stethoscope, listen to the hearts and the lungs.
Yes. Mm-hmm. We checked most of the horses, and also I was supporting Petra with my medical advices, like how she can provide the horses better care in the future, like basic wound management, or what to do and when, like, you know, some basic knowledge that is really helpful for everyday life of the rescue. Yes, and I was also supporting Petra at the lameness examinations, which is my favorite topic, so it was basically a pleasure for me. And I was also supporting Petra at her visits with her clients for dressage in hands. So yeah, I was watching the lessons, but I was also happy to try it myself and to work a bit with the horses in the rescue.
Yeah. So I learned a lot about of you. I learned a little bit to listen through the stethoscope, and yeah, where are the places where you should keep the stethoscope, and what kind of noises it is supposed to make, and which noises it's supposed not to make. And I'm still learning, of course. And I learned a lot about the lameness checkups and other treatments, and about medications, several kind of medications. But my question to you is, what did you learn? What do you take home from here that you never thought that you would learn here before?
Yes, so I definitely take it as a big treasure for my future, because I found it that there are much more horses that still have a hope to have a happy life than I thought, and many of those horses who are here were called helpless by the owners or the doctors. So I will think twice before I decide to say goodbye to horse.
And about the dressage?
Yes, of course. Because I've learned, I had the chance to redefine also the dressage that I used to know from the really high sport dressage that I've met, which wasn't my favorite topic, honestly. I found that dressage is...
Why wasn't it your favorite topic?
Because I saw a lot of, for me, pseudo riders who are using a lot of abusive methods to get the horse collected, even in a high sport. So yeah, I didn't like it that much. So yes, I found that dressage in hand is something really different and something really friendly to horses, and it has just wonderful effects for the horse and for the owner. Like, it's not only letting the horse build nice muscles and get collected in a really friendly way, the way it should be, without using any extra tools actually, and also making a really beautiful bond between a human who is working with a horse and a horse, because you really have to give the very right signal to horse and go slowly in increasing the training with listening the horse. So that was something that I really appreciated, and I tell you that I would like to continue to learn dressage in hand, because I believe those exercises are something that I can also prescribe in my future patients, or at least to suggest consultations with the professionals.
Yeah, for example, horses with what kind of medical issues would you subscribe it or advise it?
Okay, so definitely for the kissing spines, it's definitely a good cause to train like that. Also for podotrochlear syndrome.
We use it a lot here to rehab the horses that came in lame, and then we rehabilitated them with dressage in hand, of course, because you could not ride them, and we help other people rehabilitating or improving their horses as well, both sports horses and also just like hobby horses. Right? And yeah, it was really nice to teach you or to let you make how do you say that, to introduce you to this kind of work in hand, because you had a very negative idea about dressage, and what you probably saw is that the horses were used for dressage instead of the dressage that is used for horses, to improve horses'
Yes, definitely.
benefits. Yes,
Definitely.
and yeah, I'm happy that you you consider this as let's say for kissing spines, for another option next to injections or surgery, and then you can work on the cause, and not only on the appearance of the clinical. Okay. What have you until now seen? What kind of illnesses or medical issues have you seen the most in horses until now, generally speaking?
Okay, so I would say my top 3 favorites are first colics. Of course, there are a lot of them in the clinics. The second would be all the variety of lamenesses in sport horses. A lot of problems coming from the bad training or from too early sitting and beginning the training, and overgrowth, overbreeding for the effect, for the nice muscles. Yes. So a lot of lamenesses in sport, a lot of musculoskeletal problems. That would be the second one. And the third one would be negligence of the horses, who are especially the older horses and the horses, the ponies, especially in the like children riding schools for beginners. That would be my top 3.
Yeah. And how do you mean neglecting these ponies? In what way would they be neglected?
I mean, they very often eat too much, and they work too much, and people very often use the same equipment for all the ponies that they have, like one saddle for all the for the group of ponies, and which is of course very bad.
Yeah.
And that would be or.
That's a concern.
Yes.
Yeah, that's a problem. Yeah.
Yes, and then a lot of laminitis in ponies. So like general status of the pony's life is very often not so good.
Yeah. And what would you, from the preventive side, recommend to horse owners who come to you?
I think we can prevent a lot of problems simply by respecting the natural horse's needs, which is friends, forage and freedom. Each horse should have a companion. I mean, forget about keeping your horse alone on the pasture without any other horse. The second of all is forage. Like, they should have always access to forage, like 24 hours a day. It's really, really important for prevention of colics. Also, especially in the winter, we should check if our horse is drinking enough water, because they are less willing to do it in the winter. So then it's really often to see the colics in the winter. The third, freedom to move, like to explore perfectly 24 hours a day outside is the best option for the horse. But if you have to take your horse back for the night, then it's fine for 12 hours as well, but as much as possible. Also, freedom from pain, which is regular visits of dentist, regular visits of farrier. Freedom from pain is also collaboration with physiotherapist. If your horse is tense, we should really first go to the fundamental horse rides, and then we can speak more. We can speak in the details now. But yeah, that would be my message. So we would first respect the fundamental horse needs, because it sounds to be really obvious, but our world is a bit upside down. And yeah. And if it comes to lamenesses, it's really important to do a proper prophylaxis from the really first day of the fall. Like, just the foal should have unlimited access to movements from first days of life. On the first days of life, he can already go to the field with mother, and it's really good to have diverse ground, like more soft and more hard, up hills and down hills, so he could really do the training of his bones and muscles and ligaments. The other thing is proper timing when it comes to start training with a horse and sitting on it. So like at 3 years old, we can start encourage the horse to movement together with us, but only from the ground, like to show the horse that he can have a joy from contact with human, but it's not the right moment to sit. But it's a really good moment for dressage in hand. Then putting the saddle in the right moment. It should be 4 or 5 years old. Then we can start trying to sit on the horse at the age of 5 is the first moment. And then we slowly increase the intensity of the training. So at the age of 6 or 7 we can start riding dressage, and also those are the first moment for jumps. And so that would be my tip for
preventing
lamenesses. But it's really important, the cooperation between the saddle fitter and also physiotherapist and a farrier, so we could together work on the prevention.
Yes. Okay. Thank you very much for your contribution. And is there a very last thing you would like to say to our followers about our foundation, or anything else that you want to say before we close this interview?
Yes, so I believe that my motto as a veterinarian, or hopefully as a future orthopedist, is to tell the people that it doesn't matter if it's the horse from the really high sport or the horse which doesn't have that big meaning for the word. It always stays the horse, and the horse doesn't need us. This is us who are needing them for sport, so, and for our motivation or pleasure. So we owe the horses the full respect for that. And the other thing is that I really recommend you to come to the Recue, to meet the horses. I promise you that it's an amazing experience, and Petra will be your better boss. And especially for the young vets or veterinary students, you can really learn a lot about the medical cases that are here. So I really recommend you to come and volunteer, and also to donate the money, because this is how the foundation exists. It's never sure what the future brings, but as long as we help, then we can give the horses a good life, no? So yeah.
Yes.
Thank you
yes,
so much.
indeed. We can always use good help and volunteers, and of course also donations, even if it is only €1 a month. I mean, most people can miss €1 a month, but we cannot do the work we do without any money at all.
Yes, exactly.
And we could even help more horses if we would have more money, and we could help the horses even better. Now we have to do it with the means we have, which we do quite well. I think. I hope. But it's always an option to improve, and we could need all the help necessary. And therefore I'm also very glad that you as a vet took the opportunity to come and help us here. I mean, you could have done other things, you could go on trips through Europe or whatever, but you choose to help us as a volunteer, which I respect very much. And I will definitely miss you. We keep in touch anyway.
Yes, of course.
So, and I wish you all the best in your new job in Denmark, and hopefully we'll see each other very soon again.
Thank you so much. I also would like to say thanks to you. It was a wonderful time, and also to the people who let me see their horses while lessons. Thank you for the possibility, and also for your hospitality, and for speaking English with me. Thank you so much, and also to all the people who I met here in the Recue, for sharing your stories and spending time together. It was really open-minded experience for me. Thank you.
Yes, indeed. It's good that you mentioned it. It was very nice of my customers to allow that you could join, and I would give the lessons in English instead of in their their own language, Dutch, and yeah, especially also Joost, because he let he let you take lessons with his horse.
Yes,
although it's actually his lesson.
I will never forget Dallas.
Dallas is a great horse, and Joost is a great client.
Yes, exactly.
And all the other clients as well. Thank you for allowing to bring Olga as a student for dressage in hand and groundwork. Yeah, hopefully she will spread the news of the world, the benefits of dressage in hand, and how it can support lame horses and stiff horses and traumatic horses and all of that. Okay, that's it. Yes, thank you very much again, and okay, we leave it at this.